Hi, everyone. I'm Morgan Romero with KGW. This was originally supposed to start at noon, but we had some technical issues, as is live television. So welcome. We're a little bit late, but we definitely wanted to bring in these experts for you today and answer a lot of the questions that you undoubtedly have about school reopening and a return to in-person learning. For some background information, Governor Brown gave school districts the flexibility this week to decide on their reopening plans. So school districts throughout the state of Oregon have control over whether they're going to reopen for in-person learning. Some districts like Lake Oswego have already decided they're going to introduce K through 5 and have some students back in for some form of hybrid learning. And meanwhile, other districts like the state's largest PPS have said that they're maybe not going to let teachers and staff back in until they all have access to COVID-19 vaccinations. But again, a lot of you have questions and we wanted to get to the experts. So we're going to bring in two people from the OHSU-PSU School of Public Health. First, Dr. Alex Foster, and second, Dr. Leslie Bienen. And you guys, can you please provide me a little bit of your background? First, Dr. Foster, you know, we're bringing you in to talk about school reopening, kids, transmission of COVID-19. Kind of share some of your background with our viewers so they understand who you are and where you're coming from.
Sure. Thank you for having me. I'm a pediatric hospitalist up at Dornbecker Children's Hospital. I'm also trained as an epidemiologist, and that's my position in the School of Public Health, where I also am the director of the MD-MPH program, and have been engaged in the data around school, the challenge of when to safely reopen our schools from early on, in part because of the recognition that I have as a pediatrician of the value that education brings.
Thank you. We're happy to have you on. And Dr. Bienen, you are a faculty member at the OHSU-PSU School of Public Health. Where does your background come from?
Morgan, I can't hear Alex.
Oh, we will work to fix that.
Okay, should I keep talking?
Yeah, in the meantime, we're live right now. So yeah, in the meantime, if you want to just tell us your background.
Okay, so I'm a veterinarian and a faculty member at the School of Public Health. My research background is in infectious diseases that cycle from wildlife through livestock to humans. So very apt for SARS, and I specifically looked at infectious diseases across large landscapes. And I also teach in the undergraduate program. So veterinarians have always been a huge part of public health. I mean, I'm not on the ground in public health as a veterinarian, but that's certainly a huge part of our training.
Okay. Thank you so much. We're so happy to have you guys. You know, like I told you both, the biggest question here and the fundamental question is, what are the risks of bringing kids back into school and what are the risks of keeping them home? And I think a lot of those, you know, both sides have very valid points, and there are risks in each facet. And so it is this fundamental question of safety and health concerns around reopening schools and bringing kids, staff, and teachers back. So first, I know, Dr. Bienen, you may not be able to hear Dr. Foster, but let's start with you. Do you think at this point in the state of Oregon, looking at COVID-19 metrics, looking at, you know, transmission rates among children, among adults, that it is safe to restart in-person learning in these bigger areas and maybe counties that have higher cases of COVID-19? Because we should mention many students, tens of thousands of Oregon students, have been back in the classroom to some degree in rural districts and in private schools. But kind of for the rest of Oregon, do you feel it's safe?
Morgan, I could not feel more strongly that it is safe and that we are doing children a horrible disservice to not have them back in classrooms. Certainly, I would not be saying that if I thought that I was putting people's lives at risk, or even my own life at risk by sending my own child. We just have not kept up with the data in this state about what it's safe to do in terms of schools. Every day, new studies come out saying the same thing. That is, the risk is very, very, very low, and the risk and harms to children are very, very, very high. And specifically around widening equity gaps in learning, in reading and math, and all these things. So yeah, I have no hesitation in saying where that calculus lies, that we are making a huge mistake by continuing with remote learning.
I'll absolutely ask you a follow-up question to that, but first, Dr. Foster, do you think it's safe to return to in-person learning for most of Oregon schools right now?
Yeah, I think it is. The challenge is in terms of looking at the risk is obviously related to COVID. And there are, as the governor identified today, there are, with appropriate safety precautions in place in the state, the Oregon Department of Education has outlined a lot of those in its Ready School Safe Learners document, but it's basically, masks, distancing, and both hand hygiene as well as cleaning high-touch surfaces. With those precautions in place, the evidence has shown that transmission in the school is minimal, and schools are a safe and stable environment for kids. That said, we are certainly in areas of higher incidence of COVID right now. Schools are not islands. They are not where if we opened schools in a high risk area, there would be cases of COVID identified because schools and communities do interact, just to be very clear on that. So, and that shouldn't be a surprise. So, but the transmission, the risk of actual transmission, both back to the community and to families from being in school specifically seems to be very low.
And we look at the data that shows what you just said, the data from the UK, from schools in other states, obviously not Oregon, but it shows that the data, transmission is very low among students to students, students to adults, adults to adults. But I think that the biggest question here, and I think what a lot of pediatricians even can agree on, those that I've interviewed, is that the concern should certainly lie in adults acquiring the virus outside the community and bringing it into the school. I'll ask you, Dr. Foster, would that be maybe the biggest concern about having schools reopened, is adults acquiring COVID outside in the community and bringing it into the building?
I think that's fair based on the data that we have, and not just that, but you mentioned the UK data, which is pretty rigorous in terms of the ability that they did in terms of testing and contact tracing for their outbreaks and when their schools were open. And roughly half of the small outbreaks that they had were determined to be teacher-to-teacher transmission, or staff-to-staff, I should say more generally. So that does seem to be the highest risk situation. Is reasonably low from teacher to or staff to student, but I think you identified the highest risk group, and it's hard because it's similar in the hospital. We just thinking about ways to be more innovative about how adults interact in the school is going to have to be part of this. Similar to how we've done it in the hospitals. We don't sadly, have much social interaction anymore. We do our work and then we eat separately and things like that. We have to take precautions.
Yeah, absolutely. That's a perfect follow-up. We asked all of our viewers and audience on a bunch of different platforms to send us their questions because, like we mentioned in the beginning, a lot of people have questions and concerns about this. So Julia Mazur-Stevens asked us, what are the risks of bringing kids back to school that teachers and staff may face? We did just touch on this, but Dr. Bienen, I'm going to ask you to answer this question for me from your perspective.
Yeah, so I think it's really important when you think about that question to think about what's going to happen when kids are not back in school. So many teachers have children, right? And a lot of them are of the age where they even have high school children. When high school children are out of school, their risk is very likely shown to be higher of getting COVID from a friend. When they have hours and hours in school with masks and those things, their risk to each other and potentially to their families is quite a bit lower. So I would say that you have to look at the counterfactual. Teachers aren't just staying home because they're teaching remotely. Children aren't just staying home, particularly older children. So the absolute key, like Alex said, is to get teachers back in buildings and do everything to minimize staff-to-staff transmission. That's probably the biggest problem, like you said. And we know how to do that. Masks are incredibly effective. When both people are wearing masks, transmission has been shown to be reduced to 95%, similar to a vaccine. So I think that's one reason why we should not wait for everyone to be vaccinated. I'm absolutely for vaccinating high-risk teachers, not asking them to go back to school, vaccinating people with a high-risk family member in their household. But normal risk teachers can return to school without having to wait for the vaccine if they can be careful about what they're doing. that is wearing masks, not eating together, things like that. I think that is by far where we need to be concentrating our efforts, at having health departments work very closely with staff in schools to make sure that protocols are not breached. That is absolutely where the data are saying where problems arise. And to my knowledge, nobody has died. The few teachers that have contracted it from each other have all been okay, hopefully because they are, low-risk individuals who were back in schools. But still, we want that number to be 0. And one thing that public health has shown, which is a very pragmatic profession, is that you can make one mistake and you're probably okay. If you make 2 mistakes, your chances of being okay are not that great. And when you make 3 mistakes, you're very likely to have a problem. So that is, you could take your mask off for a few minutes. Are you going to be okay? Probably. If you take your mask off and eat lunch, no, that's not a good idea with someone else. And then if you take your mask off and you eat lunch and you didn't wash your hands or whatever, then you're really upping your rates. So we want to keep those mistakes, to 0 or 1 wherever possible.
I'm so glad you touched on the personal protective measures, because that was certainly a question that we had been fielding a lot. Adults have that autonomy to take care of themselves. We've been doing this for 10 months, and if you know how to stay safe, then you know how to stay safe in a school setting. Barry asked us on Facebook specifically, why not wait? You touched on this. Why not wait until the vaccine is widespread before forcing people to risk their health? It's just right around the corner. I'll ask you, Dr. Bienen, and then I'd love Dr. Foster to answer this as well.
Yeah, it's right around the corner, I guess, is the question I have. The rollout's been pretty slow. And we know from the hundreds of thousands of school hours we have collected in other studies that it can be done safely. So I guess I would turn that question back and say, why wait? We know that every day kids are home, that they're having bad outcomes. Kids are in home suffering abuse and neglect. 20% of Oregon children are learning in a home with an addicted parent. Those are really, really, really tough situations to ask children to learn at home. Why would we want to prolong that another day when we know that it can be done safely? So I'm absolutely all for getting teachers vaccinated. I'm happy that the governor bumped them up. I'm not entirely sure it's going to be right around the corner. It's going to take some time. If it were in the next few weeks, then I would say great, because it's going to take that long for schools to kind of gear up anyway. But waiting, until April or May, I just think that's absolutely untenable at this point. We know what the science says. Schools should start today planning to how to get everyone back in the building. And in a few weeks, if the teachers are vaccinated by the time those plans are ready to go, great. But I certainly would not sit around waiting for it.
Yeah. Good perspective. All right, Dr. Foster, do you agree or do you have a different take?
I think I mostly agree. It's about layers of protection and layers of, the vaccine's not perfect either. It doesn't confer immunity. It is great, and it will be very helpful in addressing the pandemic. But, it's about layers of protection, sort of like Dr. Bienen said, or at least what I understood her to say was, masks are a piece of it. They're not perfect, but they're pretty darn effective. Distance is also helpful. Vaccines are going to be an additional layer of protection, particularly for folks at higher risk, but also in terms of reducing spread between individuals, reducing the amount of virus, presumably. That hasn't been proven yet. But that one spreads to another, even if you are infected. It's a great question. I think the challenge is that, as we've seen, vaccine rollout is challenging, and the timing issue of, how do we balance risk and benefit? I think it would be safe to return without the vaccine, assuming though you put in the precautions. So it's a great question, but I think at the end of the day, yes, you could return in the absence of the vaccine, but the vaccine will be very helpful as an additional layer of protection.
Yeah, that's truly the biggest thing that we're hearing from teachers and staff and the stories that I've been covering the last week and what we're seeing on social media from people that work in schools and that are adults, particularly if they have somebody in their household that's immunocompromised. You know, they don't have a choice. A lot of students have the choice to stay home and do digital learning. You know, should their parents be essential workers, that's not ideal, but they have a choice. But teachers and staff don't have a choice but to go back. And so for a lot of them who, one, are immunocompromised, or two, have somebody in their household who might be, that's a really difficult place to put them in, where they're like, hey, I'd rather be sure with this vaccine, or 94% or 95% sure that I have protection before going back. So it's difficult.
That's incredible.
Can I say something about that?
Yeah, absolutely, Dr. Bienen.
Yeah, so absolutely those people should not go back. I mean, and I can't imagine that districts would force them into that situation. I mean, and I know their unions have negotiated that piece in other places that have opened, like Chicago, and Chicago is starting to open. You know, the thousands and thousands of districts across this country have negotiated that problem. And we know that some families want to remain remote, and so teachers will have that opportunity, particularly until they were vaccinated.
Yeah. You would hope that districts have that plan in place.
Yeah.
Dr. Foster, what do you think about it?
About higher risk individuals?
Yeah, about kind of, you know, teachers saying or staff saying, I'm immunocompromised. I hope my district has a plan in place, or I have a significant other or family member who's immunocompromised, and I'm worried about going back before I have that protection from a vaccine.
Oh, right. Absolutely. I mean, I agree with everything she said in terms of those individuals especially shouldn't be forced to go back, especially. But I mean, I think that's a better question for PPS, honestly.
Yeah. Yeah. We got another question from a viewer. Finn Hannerhan said, is it true that it's safer to open school for younger kids? And if so, why is that? I'll let you guys decide who might tackle that first.
Maybe I can start because I've spent quite a bit of time. Is that okay, Alex?
Go ahead.
Yeah, looking at high school data. And a lot of districts have said, you know, we're going to start with younger kids. To some extent, that does make sense, because we know that viral replication in younger kids is not good. They don't have the same receptors as older children and adults, older teens. So that does make sense. I think there's a couple of new studies that have come out, though, that have really supported the idea that we need to get high schoolers back as well. So one in particular, a really brilliant and elegant study that's brand new, that said, basically the author said, look, testing is a morass that we don't know how to deal with, because districts are testing totally differently. Some districts are, you know, spot testing everybody once a month. Some districts are just testing people who show symptoms. It's very, very hard to compare based on testing. So let's just look at the outcome we care about, which is hospitalization, right? We don't want people to get sick. And they looked at every single county in the U.S. and compared whether hospitalizations went up in districts where schools were open. So, you know, just sort of raising the whole testing question, which is absolutely great public health, right? And what they showed was that when community spread was below a certain level, there was zero rise in hospitalizations, even in districts that were open, including high schools. So that's a really key piece of information. I looked at Multnomah County's hospitalization rates, and that's what they were looking at. And every single week, we were well below the cutoff that this study used as high community spread. So basically what they said was, when hospitalizations get above 44 per 100,000, we don't really know whether opening schools is a good or bad idea, because the data get very wild at that point. Like, are these districts where everything is open having more spread because people aren't wearing masks? Like, it just becomes very hard to tell. So they use the cutoff of 44 hospitalizations per 100,000 people. You can look at every single week our hospitalizations in Multnomah County, and we have some of the higher spread in Oregon. We've never exceeded that threshold. Most of our weeks were like 4, 8, 12. The highest week we had this entire time since last March, we were at 22. So extremely low compared to what they were looking at. And I think that's really, really telling. They also, like I said, those were in places where high schools were also open. High schools have been trickier for several reasons. That is, that students socialize outside of school with each other, not under parental control. So the biggest problem that I've seen in opening high schools is that a bunch of students in the same cohort will test positive. They don't really know if they've gotten it at school or if they were all socializing together, and they have to shut down that cohort. And that can be very stressful on educators and on everybody. So that's more of the bigger problem. It's not necessarily that any more staff are getting infected. They're not. But it is a problem that they more often have to go to remote learning and be prepared to do that. Now, the good thing about high school is those students can be home alone, generally speaking, right? So this problem of like having to find childcare when you shut down isn't as big a problem. But I would say when opening high schools, the flexibility piece is really important, that districts be prepared for that eventuality.
I'm so glad you touched on that. And that's certainly a topic I want to revisit later, is what happens when one person tests positive. I mean, is there effective contact tracing? But I do want to get to that in a bit. Dr. Foster, do you believe that the data substantiates the fact that adolescents get COVID-19 at higher rates, are more susceptible, they can track the virus easier, and that's more of a concern of bringing them back to school versus younger kids?
Yes. I mean, I think there are a couple pieces to that. Is one, that it seems as though, so part of it's related to testing, right? So that's children who are younger tend to have fewer symptoms. And because they have fewer symptoms, are less likely to get a test. So at least initially, it was difficult to determine the degree to which there might be asymptomatic transmission in younger children. But that has been pretty settled now in terms of the school setting, in terms of it being elementary schools would be a very safe environment, given the precautions that we already talked about. In terms of the risk with older children, it's similar, and Colt Gill has highlighted this in some of the high schools that have been open around Oregon, where they haven't seen transmission in high school. So with the precautions in place, and everything that Dr. Bienen just said, I agree with in terms of the data supporting that. That in the absence of precautions, there is an increased risk of transmission. Adolescents act more like young adults, and we don't fully understand why that is, but at least from an epidemiologic perspective, they certainly have the potential to spread more. But in the context of using the precautions, it seems to be safe.
Okay. We do want to bring up another viewer question. Kelly Tilden asked, is there a holiday surge in Oregon? We've been seeing that in many other states. If so, how does that impact the risks of returning to school now? It seems other states have higher rates and they're making it work. Dr. Bienen, we'll ask you first.
I would say we didn't really see the big surges here that people were worried about. We definitely had a surge in November. It certainly wasn't the disaster that was sort of predicted. There's a natural break after Christmas anyway, and the coming back now in January, I don't think it's a reason to revisit going back, because most of the schools that I'm hearing from are really talking about February anyway, which is reasonable because the second semester is starting, and transitioning now, with a couple of weeks left in the semester would be kind of silly and disruptive. But as far as getting everything going in February, no, I don't think it's a reason. And the really massive thing to keep in mind here is that Oregon's rates are very, very, very low. Even though, we've had some surges and things sort of bumping around in November, our data for January is a little bit hard to interpret because the OHA reported that they had a data glitch where they dumped a bunch of data from June through December into January. I'm not really sure why. So there were a couple of days that saw like a big peak, but they were not actual peaks. They were reporting errors. So no, I would say no. I don't think there's really been a huge holiday surge here. And the bit of rise we've seen, I don't think that will be an issue in early February. In general, our rates are just very low still. We're the third lowest in the country. And yet I would say we have the fewest percentage of kids back in school are here in the Portland area, San Francisco, and LA, which is having a big surge. But we really aren't.
Yeah, we've been saying over the last several months, as more schools have reopened, that Oregon does have some of the most stringent policies in the nation. Dr. Foster, what is your take on that?
I mean, I think it's a little bit early in terms of as far as the data thus far. We haven't seen much of a surge post the holiday, but I think it's too early to say, honestly. In terms of the latency of, or the time it takes that you can potentially transmit this, and then the time it takes to develop symptoms and seek testing, I think it's a bit early to say. And I'm not criticizing Dr. Bienen's assessment. I'm just saying I think it's early to say that we got away with the holidays without a subsequent surge. I think the real challenge with surges in schools, though, that we should talk about is just the staffing and the challenges of, even if the transmission is low in the community, and I know schools are addressing this or trying to, that's a real challenge in terms of the stability and doing this going forward over the next few months. I think it's a challenge we need to overcome, and that schools are going to try to. But even if schools aren't a source of transmission, if there's significant surge in the community, that's going to cause a lot of quarantining and, the little pods or bubbles or whatever you want to call them to have to shut down. So it's a staffing challenge, but I think we could, yeah.
Yeah. I interviewed a pediatrician this week whose main message was, with this new strain popping up, we don't know much about it. We do know, though, that it appears to be easily transmissible, perhaps more contagious than the prior virus. So this mutation being brand new, being, spreading in surrounding states and surrounding countries. So Alice asked, what about the new strain coming out? Does that factor in at all? Should schools be weighing that when deciding whether to go back to in-person or to in-person learning? And I think that really falls in line with what we were just talking about. Dr. Foster?
Yeah, I mean, it's, what we've learned in this pandemic is you have to respond to new information. So right now, I believe the CDC is working on surveillance related to sequencing to determine the extent to which that new strain is circulating. If we were to get new information that shows that strain is circulating significantly in Oregon, that would certainly be a piece that the state and the school districts would want to pay attention to. I agree that being open to, we should not get down a path of we have to open schools regardless of whatever happens. That would also not be a safe mindset to be in. We have to adapt to new information. But right now, at least, to be clear, we don't have data that suggests it is widespread, that strain is widespread in Oregon. And the precautions that are still in place even in those settings, have been shown to be effective in schools.
Okay. And Dr. Bienen, I want to ask you, we talked about immunocompromised significant others, and Dr. Foster even touched on the fact that essential workers, doctors, this entire time have had to take all these personal precautions. So one person asked us, if my spouse ends up going back to in-person instruction, what precautions should we take when they leave home, leave school, and then arrive back home? We can pull that question up on the screen because I think it is a question that a lot of people have. It's something that essential workers, including perhaps Dr. Foster, have been dealing with this entire time of stripping down their clothes and jumping in the shower and putting all of their clothes in the wash. So Dr. Bienen, what do you recommend?
Yeah, I think that's a great question. I think the thing to focus on is being most careful in the environment where you could possibly catch COVID. And like I said, we're seeing such low transmission at school. North Carolina just released a new study of 90,000 students and educators, and they had virtually no COVID transmissions, and they did excellent contact tracing. It's in pediatrics, this most recent issue of Pediatrics. They said that they found 32 instances where they were fairly confident that there had been transmission at school. They were all adult to adult, out of almost 100,000 people. So, I mean, that honestly makes teaching probably one of the safest professions out there. That's an incredibly low rate of COVID. I think that things like washing your clothes is not a good use of your time. We know that COVID is not being transmitted on people's clothes. But washing your hands, of course, would be important. And then I would say, you know, you really have very, very, very little to worry about unless somebody tests positive in your spouse's cohort. And then I would obviously get tested for that person and, you know, maybe stay away from each other until you get your spouse's test back. And I want to say something about the masking at school. I've seen on a lot of the union's requests, the demands to go back N95 masks as something for teachers to wear. One of the dogmas of public health is that policy isn't effective if people won't do it. And the reason I'm stating that is this is really an important thing. Masks are worn when they're comfortable. N95 masks are uncomfortable. You are most likely to take a mask off if it's bothering you. Those little blue ones that you wear, you know, when you go to the dentist or whatever, those are very comfortable, they're very light, and they work very well. So a kind of mask that you're going to be like taking off is not good, and it's not necessary to have an N95 mask. So I think all staff in buildings should be wearing comfortable masks that they won't be tempted to take off. And that's what's going to keep a staff safe, and in this case, the person's spouse safe. So personally, I think for teachers to be asking for N95 masks is just a huge mistake, and it's going to lead to people not wearing them.
That's so interesting. I want to ask a follow-up question to something that you said earlier, Dr. Bienen. You mentioned that there were no deaths from educators or students related to contracting the virus at school. I covered a story on Sunday where people were putting up flags saying, 500 educators and students or children had died related to COVID-19. And we are seeing some stories, that teachers have contracted the virus. Contact tracing is difficult, right? But teachers have contracted the virus in a school setting. I mean, do you know anything about that? Because we do know many educators, small fraction obviously, but many educators have died.
As far as I'm aware, there aren't any that contracted COVID at school. I mean, a lot of the educators that died, and that's a very, very small number when you think about the number of educators in this country, they're people, they're humans, they're traveling, they're socializing, they're going to see family just like other people, and probably a lot of them are much more careful than the general public in other professions. But as far as I am aware, none of those deaths were linked to school transmission. Most schools were closed for a really long time. Right. So educators, obviously, like everyone else, were getting COVID outside of school. But if you put that figure over the denominator of 3 million teachers, that's 0.014% fatality. It's very, 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 very low. I mean, honestly, teaching right now is probably one of the safest professions, and not just because schools are closed. I mean, even in schools where that are open, I don't think that there have been deaths of teachers. I'm not aware of any. I could be wrong.
Okay. Yeah, no, certainly something to circle back on. And it's difficult to look at national data. And we can really only look at like local news stories and say, hey, yeah, certainly this teacher contracted it. But even figuring out where somebody contracted the virus has proven to be very difficult throughout this pandemic. Dr. Foster, what is your advice? I imagine that you are consulting with public schools. You have connections with principals. But what is your advice? Should a student or a staff member, teacher, get COVID-19, what should schools do? Do they shut down school, or do they kind of quarantine those folks, or quarantine the people that were in close contact with them? What do they do?
Right. So it is the, schools, the thing that has been shown to be fairly effective is, and it has to do with how you design the small cohorts coming back. Because if you have an identified case, then in order to prevent the spread, it is the reasonable thing to do is to have everyone in their cohort that was potentially exposed quarantine for some period of time and receive testing. So it depends a little bit on, so that would be what I would say is that small, so the way to minimize the disruption to the school is obviously to set up the school in such a way that it has small cohorts that exist within it, and reducing the exchange between those cohorts, or the interaction between those cohorts, so that when a case is identified, 10, 15, 20 kids have to isolate and stay home, but not the entire school. That would be the advice, or the balanced advice I would provide.
Yeah, that makes sense. You don't want kids to be on this boomerang of going from in-person school to distance learning. And obviously districts have to have these plans. That's been kind of the stipulation the entire time. But you don't want to have to bounce kids around like that after all the things that they've been through this year. Dr. Bienen, would you agree, keeping them in the cohort and isolating that cohort afterwards?
I agree. And I think this is the tricky part about high school, because students aren't all on the same schedules, right? And I think this has been a real thorn in the side for high schoolers. And for districts to figure out how to get high schools open safely. But I do know it's being done. I'm not a school administrator, so I don't have all the details at my fingertips about what they're doing. But for example, hybrid schedules can help with this because half the school's not in the building at the same time. So potentially your worst case scenario would be that half the school wouldn't be able to come. I think it's not even that bad, that they have been able to separate them somewhat better than that. But potentially you are quarantining or removing more students from the school than you would have to, in a kindergarten setting where it's just one class. Right. Ohio's done some interesting things that we should be looking at around quarantining and saying, we're really over quarantining kids. We don't need kids to be out for 2 weeks because of a potential exposure, that if they test negative a few days after the initial exposure, let them come back. Things like that. And I know Oregon has gotten a bunch of new tests available, so that would potentially help. But looking at strategies to deal with the cohort issue in high school is essential. We have to go and look at what other people are doing. I don't understand why Oregon keeps trying to reinvent the wheel here. Rhode Island has gotten high schools back. Michigan has gotten high schools back. Marin County in California has been incredibly successful. My dear friend is the county public health officer there, and they have 85% of their schools open, including high school. And they're seeing no transmission. They've literally had 6 transmission events over 560,000 school days, kids of school days. And they were all from adult to adult, like I said. So they're doing it. Can we please go out and figure out what they're doing? It's mind-boggling to me that we're sort of sitting here saying it can't be done.
That's such a great perspective. I'll ask you guys each, do you consult with public schools? Have the districts been coming to you, or perhaps State Department of Education been coming to you guys and saying, hey, what can we do?
They're definitely not coming to me. And I think one of the really missed opportunities that we have in Oregon is that the county health departments, at least from what I'm seeing, aren't as embedded in this situation as they need to be. And I'm using my friend in California as an example of how it could be and how it should be. He and his deputy public health officer in Marin County are on the ground doing this with schools. He's been completely committed to getting schools back. He has met with superintendents. He's meeting with school boards. They're having town halls. They're doing all the things so that schools can feel confident that their plans are safe, that they have support of their county health officers. And I don't really know, because I'm not on the county health side, how our Multnomah County Health Department has been involved, for example, or what's happening in other counties across Oregon. Just from what I read in the paper, I'm not really seeing that there's a lot of integration happening. And I think that's something that Oregon should and could be doing really, really differently. So I asked my friend, hey, would you be willing to talk to any of our county health officers about what you're doing? Because what you're doing should be a model for this whole country. And he said, yeah, he'd be happy to. So I hope if any of you are listening, you'll take him up on that offer, because he's doing incredible things in California.
I was going to say, if anyone's paying attention to this, hopefully they'll heed that advice. Dr. Foster, have you been consulted at all?
I have talked to a number of different educators and educational leaders, not Portland Public Schools. I know that they consult with folks, Dr. Peter Graven from OHSU, who's fantastic, and a couple of, I think they have a couple outside consultants from DC Children's as well, working with Portland Public. I have not done any formal consulting. Have enough on my. I mean, I would be happy to, on some level, but you know.
Being a faculty member at 2 universities and teaching and being a physician. Well, I think you guys essentially answered the questions that we have. That fundamental but very complicated question are, what are the risks and benefits of getting kids back to school? And it's really interesting to hear your perspective. Here we are in January. School's been closed for several months, and you're saying the risks of keeping kids home certainly outweigh the risks of sending them back to in-person learning, and it outweighs the risks of sending adults, staff, and teachers back to in-person learning. So yeah, it'll be interesting to see what districts decide. They have to pretty much make a decision here in the next couple of weeks, and the state's going to be updating its guidance by January 19th, so we'll keep our eyes on that. I really appreciate you guys weighing in. Thank you so much for your time.
Thank you. Thank you for having us.
Bye-bye. And thanks, everyone, for joining.